Hi, I'm Dr. Cody Grigsby.
I'm Dr. Dubarry.
Today we're talking about hip with coxarthrosis.
And what is a coxarthrosis?
This big femur that we have that goes all the way through the thigh, it forms a ball and socket joint into your hip.
And if the cartilage on that ball and socket gets worn out, it grinds. And you start to walk and to limp. And you start to have pain right here and on posterior part also.
And then you start to compensate and it can lead to a whole bunch of other things. But the best way to treat something like that is through decompression. Today we're going to show you a little bit of a self-help exercise, routine, movement that's going to help you relieve the pressure in that area.
Now we want you to understand, a coxarthrosis to a certain degree will need surgery. And surgery is great on hip coxarthrosis right away, because basically now they are safe surgery usually, and the results are drastic. People who could not walk suddenly walk. But very often you have to delay that surgery because of your age, because of other conditions, because just your schedule. So in those cases, delaying for 6 months, a year and a half is possible. And that self-help will help you to live with it, to not be impaired early in the morning, and to be functional and almost pain-free. So let's do it.
Let's get into it.
You are the patient?
And I have a right hip pain.
All right, you are the patient. So we're going to have Dr. Cody on the back, and we're going to state this could be a stool, a chair, or anything like that. So I'm going to leave him a little room. You can straighten your feet over there. And I'm going to put his knee at 90 degrees. I'm going to ask Cody to press with his ankle downward, to raise his hip up, and to wiggle. That's it. And that movement will create a distraction at the level of the hip. Very simple. And he will feel better right away as he gets up. Now we have done that for a certain portion of that ball and socket joint. So we want to get the whole ball. So we're going to put a little bit more flexion and ask him to redo that. Okay, and then we're going to put a little bit more extension to that hip, and we're going to ask him to do that again. Now, the whole protocol should last 3 to 4 minutes, roughly. And you can divide that in different steps with the knee at different level of flexion. And you can do that alone. This can be a chair, you can be on the floor. No, it's not a problem.
Now, if you have a partner, you can do a lot better motion with this, and it has to do with resistance and then more flexibility against it.
So I'm the partner here. I'm going to push his knee toward the inside. So push, resist, relax. So he resisted and he contracted those muscles on the external side against my push. Push again, beautiful. When he stops, I'm going to stretch those muscles. And that is called PNF, post-neural facilitation. And basically it allows us to give more motion to that femoral head again, and by stretching the muscle. So we're going to push him to the inside, he resists, relax, and I stretch in. Push it, resist, and I stretch in. And we're going to do that the opposite way, so in external rotation of the hip, you're going to push with your knee against my hand, push, 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 relax, and I stretch in. Push, 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 relax, and I stretch in. And by doing that, we're going to increase the contact between the cartilage that has been damaged. We're going to lubricate this area a little bit more. And when Cody gets up, he will feel better. He will walk with a better ambulation.
Now, this may not be the most comfortable self-help you can do. If you do have arthritis, it's going to be a little uncomfortable. But as long as it's not sharp, stabbing pain, you can push through a little discomfort. But if it is a lot of pain, we want to stop.
And remember, if there is pain, you stop. You gain only when you perform the motion without pain. Test it and have fun.
All right.